Hello everybody, my name is AJ Clevenger. Today we'll be doing a sinus trigger. What the sinuses consist of is PA Caldwell shot. Another one is SMV. Another one is a parietal acanthial, which is Waters, and a lateral. So today, before we get the patient, what we want to do is set up the room. What we have here is the x-ray tube. What I have here is a cone attached to it. Extension cone, so we want to get the clear picture that we need for the doctor to read. Also, you want to do is clean up your board first, because your patient may come in contact with this, which a lot of patients already come in contact with it, so you want to wipe it down. It's really good ingredients in here to destroy germs and all those bacterial infection stuff. So also make sure you want to get your gown. Eventually want to shield your patient. And we got our tube already detented. I have it about 42 inches, so I like that number. I got an 8x10 right here, already set up. Go ahead and push that guy in. Alright. And got my markers. Got a chair for him to sit down, just in case if he's tall. We'll see. Alright, I'm ready to go get the patient. I'm gonna move this out of the way first so he doesn't get hit by it as he walks by. Alright. What we got here? Alright, Mr. Johnny 5. Johnny 5?
How you doing?
Hey, how's it going? Johnny.
Good.
Hi, my name's AJ. I'm a radiology technologist here today. We'll be doing, looks like sinuses today for an x-ray. What kind of problems are you having today?
Problems with my sinuses.
Yeah? You know exactly what, or?
I have no idea. I just
Okay.
need some x-rays, but
Okay, well these exams have various shots. We're going to do about 4 x-rays, okay? On your nasal area and the facial structure. So, alright, we'll have you come right over here. Alright, sir. Can I confirm your date of birth, please?
4/6/37.
37? Alright. Okay, and can I confirm your last name real quick?
Win. 5.
Yeah. Johnny 5.
Johnny 5.
Okay, yeah. And if they're female, you want to ask if they're pregnant or not. So, sir, are you pregnant at all?
Not that I know of.
Not that you know of? You sure?
Pretty sure.
Okay. Did you take a test already and came out negative?
Usually
Okay.
They usually do.
Yeah. Yeah, it's okay. Now, I get nervous too when I do x-rays, so it's okay. Alright, sir. What I'm going to do is I'm going to cover you up real quick with one of these, okay?
Oh, my favorite color.
This is only, the other one's for kids, so, this is for adults. Actually, you know what? We're going to do one shot, so we're going to, backwards. So, yeah. So you want to make sure you put it on the back, because what we're going to be doing first is the PA Caldwell. So we have the patient sit down right over here. He's kind of tall, so I may have to adjust the IR. We'll go ahead and move my tube back to where it was. We're still detented, around 40. Alright, so I want to make sure that we're still centered. I'm going to lower this door down a little bit here. Alright, sir. Alright, can I have you as close to the board as possible? I know you have long legs and everything, but we got a wall here, so everything's kind of compact here, Alright, sir. So what you want to do, we'll be doing a PA Caldwell. What we want is the OML to be 15 degrees. So you want to come on over here to the side here. So what we're going to have is the OML right here and the EAM. It's going to be 15 degrees, alright? So have your head straight right here. 15 right there. Alright? Just go and hold that position right there, alright? And make sure our tube is up here. And you want to make sure that the CR exits the nasion. Make sure that perfect. Alright. So I would use a technique at 75 at 8. We're shooting a little bit more through the skull area, so we make sure we get the sinus there. And for this shot here, what we're looking for is the frontal sinuses. Alright, so sir, go and hold your breath. Alright, go ahead and relax, sir. I'm gonna go ahead and take this out. I'm gonna go ahead and run it. Have my assistant go ahead and run that for me. Alright. Cool. Alright, everything came out good. Alright. So what we do is put it in again. It's gonna be portrait. Alright, so what we're gonna do is we're gonna do the waters, or the parietal acanthial. So we're gonna have him face the board again one more time. And this time what we're gonna do is the OML. I want to come to the side and see this here. So we're gonna do the the OML is gonna be 37 degrees this time. So a little higher if you can, sir. And this time it's gonna be, let's see what's perpendicular. 37 degrees. And then this shot here, the CR is going to exit the acanthion. So you want to make sure you're exiting through the acanthion, which it looks like it is already. At 37 degrees, looks about good. Okay, so for this technique as well, what I'm going to be doing is another 75 at 8. Sir, don't move. Don't breathe. Beep. Okay, so we're done with that shot there. Go ahead and run this film here. Everything came out good. Right. Okay, so for this shot here, we're going to be doing the lateral. Okay. So sir, I'm going to have you, where does it hurt the most? The left or right? What do you think?
Left.
The left side, so we'll have him doing the LAO. Okay. So LAO gets the board. Sorry, this is kind of a weird position here. So what we want is the inner pupillary line to be parallel with the IR. So we got this line here, so you can face down a little bit, right there. So we're across the way here. His eyes are shooting straight and straight with the crosshairs. You can use that. And then where we want to center is a 1/2 to 1 inch posterior of the outer canthus. So it's about an inch. Actually, I'm going to have him move back just a little bit. Move this way a little bit. Not that too far. Okay. I'm going to move this up a little bit. Okay. There. Make sure this is aligned perfectly. Okay. So for a lateral, a technique, what I would use is, what a technique I would use for is 70 at 6. That would be a perfect technique for this guy here. So you want to make sure, since it's the left side, you want to mark the nasal area, which we can probably do this. The front side. Right there. Alright, sir. Alright, we're going to use collimate a little bit, so that way we just collimate to the interest. Okay. Alright, so we'll go ahead and shoot. 70 at 6. Sir, don't move. Beep. Go ahead and relax. Okay. So we're going to run this film. We're going to do one more view here. What we do is the SMV. Now this one's a little tricky for patients because it's kind of awkward position, but it is needed. Okay. So we're going to turn around the gown, which I guess you've done this before?
I watch a lot of movies.
Yeah? That's cool. Nice. So we'll make sure we face this the correct way. And we'll have you scoot back just a little bit here. And what he's going to do is vertex is going to come in contact with the board here, and his mid-sagittal plane is going to be perpendicular, and where we want to center is about 3/4 anterior of the EAM line right here. So we want to do about 3/4 anterior. Right there. Sorry, this is kind of. I'll lift your head up for a second. So you'll make sure that's all lined up where we want it. Okay. And then we'll mark the area in here. So for the SMV here, what we want to look at is the sphenoidal and ethmoidal sinuses. Okay, so for this technique, looks like we're going through a lot more again. So I would say about 75 at, let's say 8 again. Okay, so don't move, sir. Don't breathe.
We'll try.
Beep. Okay, it's all done. All right, sir. Hopefully that wasn't too bad, was it?
Just the limbo part.
The limbo part, yeah. Okay. Well, Mr. Johnny 5 here has been a great patient today. I hope you enjoyed this. I know I messed up on a couple of things, which is my markers. I forgot to place them, but if I was going to, I'd put them on the correct side. But other than that, I think everything will be good. It's Mother's Day and tomorrow, so I thought that was important for this trigger.
It's the Mexican Mother's Day today.
Oh, well, yeah, I guess so. In the Philippines, I guess it is too, because it's, a day ahead.
Sweet bread for everybody.
Sweet bread for everybody. Thanks for joining our trigger today. My name is AJ Clevenger. This is Johnny 5 Alive. I got my man Alfredo as the cameraman. Yo, take care of yourselves, alright? Alright, what we'll be doing here is a mandible trigger, mandible exam. We have a series of 4 pictures here. What we'll be doing is the PA axial, and 2 axial laterals, which I'll show you in a little bit. We got Johnny 5 back again. Doctor wanted to see his mandible, so we're going to actually do the mandible here, okay? So what I have is a shield. It's going to cover his back area again, since he's going to be facing the board. I wiped it down with that purple top stuff, pretty good stuff. I got the 8x10 in here. It's going to be crosswise. Going to put that guy inside. I already got my tube detented at 42 inches, which I like. Let me see here.
I'll turn it on.
Okay, yeah. Okay, so what we're going to be doing is putting his face against the board there. What we're going to be doing is the OML is going to be perpendicular with the IR. So we're going to turn his head down a little bit. Make sure it's perpendicular. Right there, sir. Okay. As close as possible. Okay. Right there. On the light, make sure we're straight on. Okay. What I'm going to do is I'm going to collimate to our area of interest, which is the mandible. And then I'm going to stick my right marker right about there. Okay, I've already collimated to where I want. Okay, so for the mandible, for technique, what I'll use is about almost the same as the sinus, which would be probably like 75 at like 8. So sir, go ahead and hold your breath, don't move. Beep. Okay, that's it for the PA. So that was exiting the acanthion, just to let you know. For this shot here, we'll be doing the exact same thing. I'll run this first. Alright, picture looks good. I'm gonna run this. Okay, so our next shot, what we'll be doing is an axial PA shot. So what we'll be doing is doing an angulation on the tube, about 20 to 25 degrees cephalic. Right there, I'm about to do, looks like 23 right there. See how this goes. Down here. Make sure that we're going to be centered. Right here. Okay, sir. So we're going to be doing the same thing. OML is going to be perpendicular to the IR. Make sure we got this correct here. There, sir. Okay. So we got that centered right there. Alright, sir. So it's going to exit the cantillon. Sir, same technique, 75 at 8. Don't move, don't breathe. Beep. Okay. That was a PA axial. Okay, and let's see here. So I got my right marker still in the same place as I had it for the PA. I'm gonna run that film there. Okay, that's good. Put another another 8x10 in here, crosswise as well. Okay, sir, what I'm gonna have you do is, this is still gonna be at, make sure that this is gonna be at 25. That'd be 25 because I had it at 23. So, okay, so what I'm gonna have you do is you're gonna be in like a diagonal shot here, true lateral, what we call it. What we want to see here is the ramus of the mandible. So what we're gonna do is we're gonna do it with the interpupillary line. It's gonna be perpendicular. So, sir, you turn your face a little bit this way. Perfect, just like that, sir. Okay. So to make sure that's perpendicular, and his mid-sagittal plane is parallel with the IR. So it looks like he needs to turn his head a little bit this way. There you go. Doing good. All right. So make sure that this is lined up properly. Make sure that the. Okay. So I'm gonna have you move back a little bit. Is that okay with you? Not gonna hurt you. I'm gonna scoot your chair back a little bit. So I'm gonna make sure that the CR is gonna be about midway of the, almost midway of the ganglion and the mental point there. I'll make sure you get that ramus in there. Okay. So it looks like we need to lower this a little bit. Make sure we get this shot good here. I'm going to relax that right shoulder, make sure it's not in the way of the angle here. So he's got a left side against the board, so we're going to use a left marker. We're also going to cone down a little bit here, area of interest. We'll need all his frontal bones, we need his mandible. Left side there. Okay, so he's in a lateral position, so what I'll do is lower my technique a little bit. I'll probably go 70 at 6. So we're going and holding your breath. Don't move. Beep. Okay, go and relax. So we got one more last shot here. So we can keep them in this position to make it easier on us. This next picture here is the axial lateral. Again, except we're going to be looking for the mandibular body. So what we're going to be doing is keeping the same angulation at 25 degrees cephalic. And his head to be pretty much the same way, which we got the interpupillary line still kind of perpendicular, but we're going to turn his head 30 degree towards the IR. So we're going to turn his head this way. So we're turning in about 30 degrees right there. So another way you can tell that it is lined up properly is the mandible right here is about perpendicular of the IR. It's kind of flat right there. So make sure we got that, and this is looking at the body. Make sure we're getting this guy in here. Perfect. Okay, so we're going to label this again one more time. Left side, mandible. Alright, so same technique. 70 at 6, I would say. Okay, sir, don't breathe. Don't move. Beep. Okay. So I'm gonna run that film right here. And that was our 4 views of the mandible. Once again, I'm grateful for this beautiful day to be able to be here on a Saturday to do the trigger with Mr. Johnny 5 alive, Mr. Alfredo on the camera. Once again, this is AJ Clevenger. We're signing out. Hello everyone, we're going to be critiquing the images that we just took. First we'll start out with the sinuses. What we have here on the board here is the PA Caldwell sinus. Basically what we're looking for here, sorry this candle's a little hot, it's hitting my face a little bit. But I just wanted to set the mood for everyone here. But we're focusing mainly on the frontal sinuses for the PA Caldwell sinus. We can tell that is pretty good shot just by seeing that the crista galli is being shown there, and also that the mandible is not really too rotated there. You can tell that's a good picture there. Our marker got cut off, but we still be able to use the cone there and got everything good. If I was to use the marker, I'd place it at a better area of interest. So then the next shot what we have is the parietal acanthial, which is the waters. We have the patient against the board there with the OML 37 degrees. Right here we can see the what we want to focus on is the maxillary sinus, which are these two guys here. Looks like the vomer and the perpendicular plate are shown as well, which is pretty good. But mainly, yeah, it's the maxillary. We can also see the frontal. Can't really see much of the, well, a little bit of the sphenoid, yeah. But all in all, that's a good shot. Once again, marker placement, cut off again. Next, we've got the lateral. We could have collimated a little bit better on this shot here because we're mostly just focusing on the sinus area. We don't need much of the cranial, but we can tell this is a true lateral because there's not much of a rotation here or where the condyles are at. We can see the cilia turcica. It's pretty good. It looks like a little fish hook, 1-0 hook. Bruce knows what that is. We can see all four sinuses on the lateral. We can see the frontal here. We can see the maxillary here, and you can see like the ethmoid and the sphenoid. But yeah, this looks like a good lateral there for sinus wise. We're gonna move on to the SMV, which was a pretty hard shot to get. Usually it is for patients to be in this position. We want to be quick and snappy about it. But we got a good shot here. We got, looks like we got the sphenoidal and ethmoidal sinuses here, which is the main focus here. We can't really see the frontal just because of the way the position is for the patient. It's way up in front over here, but it's not shown. But yeah, it's a pretty good SMV shot there. Once again, marker placement. Yeah, so that's it for the all four of the exam for the sinuses there. Okay. We'll move on to the mandible. We got the PA mandible here. We didn't have any tube angulation, so we pretty much shot perpendicular to the IR. What we have here is the ramus of the mandible here. You can see a little bit of the body and the gonion, which is the angle. Looks like we got all that. We collimated at a good rate there. Next is the PA axial mandible. We had a little bit of tube angle to this one. We had it 25 degrees cephalic, and the purpose of that is to elongate the mandible, so we can see the ramus a little bit better, I guess, in detail. If there's, see if there's any fractures or anything like that. Radiologists can see that. Actually got an annotation left marker there, good placement there. What we've got next is the axial lateral mandible, which on this one right here we did it at a true lateral, which we got the patient in, and looks like we're focusing more on the ramus behind here. You can see it better rather than the next shot, which we shot it the same way, but we angled in the patient 30 degrees towards the IR. So the right side is shown here, which was flat again, or perpendicular, no sorry, parallel to the IR. So it shows it, shows the whole body in this picture here. Once again, just cone down again, get the right marker up here. You see the gunny on here. And I think that's pretty much it for critiquing these images. Overall, this has been a pretty good experience. Enjoyed doing these triggers. I think this might be our last one, yeah? So, it's been a good challenge so far. Thanks for letting us suffer a little and making us think. My name is AJ Clevenger, and